How is everything, huh?
Everything is fine. We're getting back to work here in Israel. How is it in Moscow? Are you still at home?
Yeah, we're still at home, but now I'm in my clinic. Could you see the post beside of me? So it's about the Xeomin.
Yeah.
I have been well-prepared girl for you.
Okay.
And also I came to my clinic to show you some clinical aspect about the Xeomin and different syringes and etc.
What is the weather in Moscow?
Oh, now we are very surprised because it's snowing again.
Snowing.
Welcome to New Year. We are waiting for Easter, but finally we will have a New Year party again. So.
Okay.
Well, but maybe weather is decide that we need to, all of us needs to stay at home. So it's a best situation for us. Otherwise, everybody wants to go outside. Huh? Now it's okay for us.
Beautiful. And are the aesthetic or dermatology clinics, are they open those days, nowadays?
No, everything is totally closed. In some emergency situation, the government allowed us to open a clinic in some emergency cases. So we need to make a reservation to the official department of health department of Russia. So it's long chairs. So it's not easy.
Are there many policemen or soldiers all over?
Full of streets, yeah, a lot. And they check code, they check passports, official registration, everything, because we are growing. The numbers of cases of diseases now is growing so fast. It's like we allow to the peak of the disease, so the situation is not good.
Okay. Okay, so we are now 2 minutes. We're 2 minutes after 8 o'clock, and we'll start. Let me introduce you to our members. We have right now 78 participants. Dr. Maria Shirshakova is a well-known dermatologist from Moscow. She has been using Xeomin for how long, Maria?
So since 2006. So we have in Russia Xeomin from 2006. So finally, let me calculate. 14 years. Yeah, 14 years.
Wow, that's a lot. So you know a lot about Xeomin, and it's a great opportunity for us here in Israel, because Xeomin has just been introduced to our country.
Oh, great.
So we'll be very happy to learn from your experience.
Thank you very much.
We'll start with about 20-minute presentation about the pharmacology of Xeomin. And Maria will discuss some of the clinical implications for about 20 minutes. And then we have special cases for you. Some of them are very difficult. It's like our exam cases. And I will ask you to have a quick look and say, what would you do in this case? Okay? So it's going to be fun.
Maybe we will organize the discussion together, because it's very interesting to have to get opinion how.
Yeah, sure. Yeah, we'll ask the the other participants if they want to say anything. That would be great. I'm just entering a few people, and I suggest, Maria, that you start.
Oh, super good. But today is really difficult for me because, first of all, I prepare some surprise. Shalom lekulam, ma nishma, hakol beseder. All of my day, I try to learn these phrases.
Very good, perfect Hebrew.
Okay, dear colleagues, good evening, and I'm really glad to see all of you here with us, and for me, really great honor and great privilege to be with you. And let me say a couple of words about myself. So as Professor Cohen said before, I'm a PhD, I'm a dermatologist, practice in Moscow because I have 2 clinics in Moscow, and also I'm international speaker of MERS, and I have 1 clinic in Montenegro, so I have official legal diploma, and I can use it in Europe as well. And also I have my training education center, a school for the doctors who want to improve their knowledges, their skills, and their medical aesthetic. And for 19 years, I specialized in aesthetic field and in dermatology. Just why? Yesterday we had a discussion that I use a lot botulinum toxin like a dermatologist for some dermatologist disorders like a psoriasis, eczema, rosacea. But I know that most of you are plastic surgeon. That's why maybe if you're still interested about like a scars, post-acne scars, we will have discussion in the second part of our lecture.
Yes, we will.
Right?
Yes.
Also, I'm an associated professor of Department of Dermatology of Russian State Medical University. So we made some clinical trial for MERS, and it was very successful for us. And today our topic about the botulinum toxin, and I've been using it in my practice since 18 years, and I start working with Xeomin from 2006. So it's a big experience. So let's start, but for the beginning, just I try to change the slide. Tell me, is it okay? Because it's a short video. One second.
Need to share. You have to share
yeah.
the press.
Is it okay? Is some music?
Yeah,
right. Yeah.
The music is good.
Yeah, 1 second, and please listen this melody. So this what kind of situation you have while hearing it? It's a classic music, figure of Bach on harpsichord, and as you can see, the melody sounds streak and poor, and it's like from ancient times. So my main idea that the latest generation of the botulinum toxin, like Xeomin, it's a huge leap. Look at this slide. From the harpsichord to the piano, and the standard approach in aesthetic medicine, like from the harpsichord to the piano, because the harpsichord doesn't reveal all the tones of virtuoso performance. I love music, as you can see, because I have in my past I was an actress and I work in the theater, so I like such kind of association. So last generation of the toxins like Botox or Dysport, for me it's like from 19th century, for example, and the Xeomin help us provide to perform great performance, allowing to enjoy whole palette of melody and of course the beauty. And let's speak some words about Xeomin and
Maria, you want to share with us the presentation?
Yeah, but you don't have it. You don't have it. You don't see the slide.
No, not yet. You have to press.
Not yet, because I have a lot of. No. Let me do it one more again. So yes,
you press share screen.
Yeah, share screen. Green.
As we did yesterday.
Yes, of course. What about?
Great. Beautiful. Yeah, it's
so
better.
again, music and difference between the harpsichord and piano. Whole palette from forte to piano. From the old generation of the bottom-toxin for the new one, a huge leap. Okay. Now change the slide. How I need to do it. Yeah. Is it okay for you?
Yeah, beautiful.
Super,
very good.
Beautiful. Let me introduce new product from Merz. The name of the product is Xeomin. Is a new neuroprotein without extra protein loads, effectiveness therapy regardless of time. And as you can see, the Bokutur, because in Europe we name it in Bokutur or Xeomin, is totally the same, is distinguished to individual treatment for wrinkles and folds, and it is allowed to achieve incredible, I promise you, incredible results, and they cannot achieve using the last generation of the toxin. Why? I would like to explain you later. And Xeomin approved for the first, officially in your country, I know that it approved for the first treatment of glabella lines, and I'm not sure about the frontal line, but in Russia and Europe, it approved for whole face treatment. So legally in Russia, we can use it for neck, for example, for DMO, for platysma banks, for cheeks, for ginger smile, for every zone, for upper, lower, and middle part of the face. That's why I would like to show you some protocols if you're still interested about off-label education, because it really works. And Xeomin contains only the active neuroproteins with a low risk of activation of immune system, and this is the main goals why we use it for some categories of the patient with some kind of anamnesis. So the best patient for the Xeomin for me is the young patient and the patient with some chronic disorders like an allergy reaction, for example, asthma, different allergy, patient older than 50 or 55, because we are getting older, we will have a lot of disorders, as you know, and this is the best product for the patient with edema, because pardon?
No.
Is it okay?
No, it's okay. It's perfect.
Oh, okay, thank you. So let's straight ahead. Here you can see the map, and please look at the map. Xeomin is known well, and it's used almost all across the world, and you must know that it registered in 35 high developed countries, so in US, in Europe, and now you have this fantastic product in Israel. And since 2005, more than 2 million patients have been treated with a Bokutur. So if your patient says, no, it's something new, we have a huge clinical experience with this product, and no antibody titer developed in post-treatment negative patient, non-secondary non-response, and thus we can provide it like a pure therapy. And this kind of therapy gives your patient the purity result, and how to say, the most value for me, that it gives me and my patient absolutely natural results. So this is a much important for me. But today, aesthetic medicine, of course, is evidence-based medicine. So we have to make sure that our product is safe, it's well tolerated, and it's well examined. And in this case, we have a huge amount, you will see in this table, huge amount of scientific publication. of highest evidence level. So you can find it in many scientific research, and if your patient asks you questions about scientific-based, evidence-based, you can find it free in some scientific research and work in different websites. Okay. Let's have a look at the basic properties of Xeomin. Xeomin has a lot of important properties which provides a good result because it's innovative products of bottom type A, and satisfaction doesn't cause any immunological, sorry for my English, immunological reaction, and it has a great evidence base, and it's very effectiveness and very safe, and it's proved safety and when we use it in high dosage. And we have one clinical trial in aesthetics which showed us that we can use more than 500 units. Sometimes we need it for treatment of hyperhidrosis, for example, and provide the whole treatment of the face. And hyperhidrosis not only the access for another here, and it works absolutely safe. And I would like to show you that we have individual package, and you will find Xeomin, it has packed on 500 units and 50 units and 100 units, allowing us to make individual packing injection and individual approach, because some patients worrying that you keep it longer in your fridge, and I don't like to share with somebody else, and it's absolutely individual treatment. So the first recommendation for you, flexible approach to use the dosage for 100 units for upper part of the face as well as the lower one. Or if you want to treat your patient with a protocol full face correction, please, you can use the 100 units for whole treatment phase, and it's absolutely safe. And one more thing, it's a quick start action, so you don't need to wait 2 weeks, for example. It's not necessary. I will show you after some slides about this, some clinical trials, and its storage stability. So it's very comfortable, especially if we are speaking about the Israel, because it's much warmer than in Russia, for example. It's not necessary to keep a cold chain and keep it in the fridge. You can put it on the table, like I am doing it, and you must be sure that it's absolutely fine. Okay, if we're speaking about different toxin, different activity, different unit per while, and etc. Dear colleagues, please look at this table, and its goals is determination of the protein content of neurotoxin in a product, and in Europe and in Russia we use the same in our market, Dysport, Botox, and Xeomin, and I would like to show you the result of some clinical trials, and it was a method ELISA test sandwich version of solid phase enzyme using antiserum, and the conclusion of this clinical trial that the Xeomin has the highest specific activity. This is a very important message, because non-commercial information. Many doctors say that it's totally the same. It's totally the same, but I'm not sure that they are right. It's not correct. Every toxin has its specific activity, and the conclusion of this clinical trial was that the Xeomin has the highest specific activity, which in a minimum mass of pure neuroprotein. This is a very important for me. And to follow up, on this slide you will see the comparison of the foreign protein loads and specific activity. Merck company was able to do what other manufacturers were not able to do. It's very important to understand that if we are speaking about, botulinum toxin type A, all of the botulinum toxin type A contains some proteins, but the Xeomin contains no complex protein and thus has the lowest foreign bacterial protein contents at the present. And I would like to show you on this table. Let's have a look. 100 units contained in a vial of this Xeomin correspond to about 0.6, 0.44 nanograms of pure neurotoxin. And our product has a high specific activity and much less protein loads. And it proved that the few antibodies are formed in a human under Xeomin activity. One more information about this, dear colleagues. It's very interesting because sometimes we said that the activity, if we compare it with a botulinum toxin, on a botulinum toxin botox, is the same. The duration of the clinical effect, absolutely the same. But if we are speaking about the neuroprotein, we must keep in our mind that the neuroprotein here, sometimes if we compare with a botox, for example, and a Dysport, it's not only pure neuroprotein, it's some part of neuroprotein was inactivated. We call it toxoids. So this is pure toxin. So it means that it's a highest potential of specific activity, and it works like a sniper. It's a targeting individual therapy for our patient, and it's very, very important. Second one, a very high level of patient satisfaction. Why? First of all, because the safety profile as well, and tell you the truth, the safety profile is comparable to the other toxin. It's absolutely right. Xeomin has advantage in the speed. Let's have a look on this slide. In the speed of effect, onset, and low risk of immunogenicity. And all clinical studies confirm that the higher level of safety injection of Xeomin with a higher dosage, and one more very important thing with a flexible interval. And officially, they put in officially paper here in the boxes that we don't need to keep an interval. We don't afraid about secondary non-response. So if my patient wants to repeat the injection after, I don't know, 1 month with the last generation of the toxins, I couldn't do it. I said, no, we must wait 4 months, 6 months, please come back to my clinic. And sometimes my patient disappear. Because this is a pure toxin, we can repeat it wherever we need. After 1 month, 1 month. After 3 months, 3 months. But the duration of the effect, it's absolutely the same like in a Botox or Dysport. I would like to show you later. Okay. Yeah. They are very interesting. One more clinical trial because it's also comparative researches of Xeomin and Botox and a Dysport showing that the Xeomin has the fastest result in the correction of upper third of the wrinkles in the glabellar line, in the forehead, in crowface. And here you can see the approximately time to get the result. So clinically, we need to make a phone call to our patient after 3 or 5 days after the procedure, because it will be the final result. This is very important. So if you have, for example, some problem like a Mephisto eyebrow like this, or some wrinkles above the eyebrow, or some asymmetry, it's not necessary to wait 2 weeks. You must to repeat your treatment. You must provide the secondary treatment after 5 days. But with the Botox or Dysport, you need to wait. So it's very, very important for us to know this, because it's faster. Sometimes your patients say, oh, I'm preparing for the wedding, I'm preparing for the party, for everything. So it's interesting for us, and we must to keep it in our mind. This slide show one more comparative study, spleen phase study with Xeomin and Dysport. Effectiveness is, if we try to compare between the units, between the Xeomin and Dysport, it's not correct, because every neurotoxin has its own specific activity. But in this clinical trial, it was 1 to 3. For the treatment of lateral periorbital crow's face wrinkles line, and here efficacy and safety on the after 2 weeks, and day 4, day 6, and 1 month after injection were evaluated. And here you will see the clinical protocol, how it works. So we have photos of the patient day after 14, after 4 months, and after 6 months, and we can obviously see that the great clinical result of the effect of the Xeomin and Dysport, comparing to Dysport in this case, and no any clinical difference between 2 products. So if somebody tell you that Dysport it's more stronger, it's not true. Okay, so another clinical study. I know that it's too boring listening about the clinical study, but very fast, very quick.
Maria, let me summarize up to here. So you mentioned 2 advantages of Xeomin. One is storage. You don't have to keep it in a fridge before you dilute it with saline. Right?
So, absolutely. It's a last slide of our presentation, but it's absolutely okay. I can do it for you.
No, just let's summarize.
No.
One is storage.
Storage.
Okay.
Please, let's have a look. In this clinical trial, you will see that the Xeomin is stable for 4 years, at a room temperature. So it's not necessary to keep it. But for Israel, it's more interesting here that the Xeomin is stable for 4 years with a room temperature up to 25 degrees and humidity more than 60%. And if last one, if we are speaking about the temperature more than 25, again, it's not necessary to keep in the fridge.
Okay.
So it's a great advantage.
So storage is advantage 1. Advantage 2 would be speed of onset. Speed of onset. Right?
Yeah. Absolutely.
So it's effective within 2 to 3 days, which is quite different from the other neurotoxins.
Let me tell you something. Official information and non-official, right?
Yeah.
Officially, 48 hours.
Okay.
Non-officially, sometimes now is, most of us stay at home. So this is Xeomin 1 week in my clinic. So 1 week ago, it was reconstructed with a physiological solution. And if I want to provide the injection for me, it will be absolutely effectiveness. So officially 24 hours, but clinically it keeps stability longer. But the problem is bacterial contamination. So we must be sure that we keep sterile, but because it's very, very important for us, and we need to prevent any infection complication. But about stability is super stable.
So the third advantage that you mentioned was immunogenicity.
Yes,
right?
Absolutely.
And I must say that I've been injecting all kinds of neurotoxins for 20 years, and I've never seen any kind of immunogenicity problems. What do you refer when you say immunogenicity?
Let me show you one second again, presentation, 1 second. Let me show you very interesting publication by FDA. Let me find it. Yeah. Is it okay for you? Do you see this?
Yeah, sure.
So this is a little bit bigger for me. Yeah. So this is official funding from FDA. Let's have a look for. So this is a number of cases.
I think you need to press, Maria, the left button with the green arrow. I don't understand Russian, but I think so. The left, the one on the left. The left of the screen, you have this small green arrow.
No, the computer said that everything is fine. I'm online with my presentation, but...
No, we see the presentation, but make it a presentation mode.
1 second. I asked the technical staff. So, may I ask you to help me because some problem with my screen.
Could you try F5?
Yeah, one second. Yeah, because it's a problem with the internet. My computer said that you have a problem with your internet. Okay. 1 second again. They asked me about new demonstration. No. I want to save the time. No. Можешь мне помочь? Не надо, подойти, просто помоги мне. Okay, 1 second, please. Yes, 1 second, please. I would like to be sure that everything is fine with the internet because the computer said me that you have a problem with the connection.
I do hear you. Now I don't see you, but I do hear you.
Okay, let me tell you something about clinical trials of the antibodies, okay, from FDA. So, my aim that Xeomin has a lowest immune potential, and from the is it okay? Is it okay now? About the presentation, is it okay?
Yeah, it's great. Yeah, it's good. I don't see you, but please put your camera. I don't see you. Oh, now great, beautiful.
Super.
Everything is working.
Yeah, they analyzed 12,280 cases using the botulinum toxin in neurology and in aesthetics, the same number of the patient. Look at this. It was published in last year, 2019, and they report that no antibodies after intrabotulinum toxin, but in aesthetics, 11% after ababotulinum toxin and 23% after onabotulinum toxin. It's not a small percentage. Are you agree?
Okay.
Because and of course, the FDA is very, very high evidence-based organization.
Okay, I would like to ask my colleagues if anyone would like to say anything to comment about the immunogenicity of the neurotoxin. Has anyone had any problem with allergic reaction to Botox or Dysport?
Meir, if I can remark something, I think that the immunogenicity that is talked about now is the all kinds of proteins that are not the actual active ingredient that we want in the botulinum toxin that have in another preparation, and they have maybe the potential of causing what we sometimes see as the phenomena of antibodies. And not necessarily for allergic local reactions, but some immune response in the surrounding that is not necessary for achieving the botulinum toxin effect. And this supplement is being cleaned from the Xeomin preparation, and this is one of the advantages.
Meir.
כן,
Meir.
כן, בבקשה.
First, I want to thank Ilan and the group for having this presentation. Maria, you're doing a great job.
Thank you very much.
Two issues, and we will very happy to see you in Tel Aviv in our meeting on November.
Thank you very much. Thank you. With my great pleasure.
Yeah, but anyway, I'm working with Xeomin the last 3 months, and we have very good results, amazing results, and we haven't seen any immunity as we haven't seen before with the others. But although I'm working with Xeomin, I want to move the audience here to a clinical trial on PRS by Wilson, Chang, and others. It was published on 2016, on May 2016, volume 137, and they compared Botox, Dysport, and Xeomin, and they have some different results as you showed. And but okay, from my point of view, all botulinum toxin are working great. I must admit that for my patient, I like the Xeomin the best. Although what they say in the, every company is showing her best results. So, but keep on. It's great work that you are doing there. Thank you very much.
Tal, what did you find is the most important advantage of using Xeomin?
No. What they say in this clinical trial, I can send the team. I can send the guys on society.
But based on your experience, what is the most important advantage of using Xeomin?
First, that we don't need to storage it.
Okay. Is that a problem?
It's a huge advantage. Okay. It's not a problem, right? It's not a problem. Second, I must agree that, as Maria said, we have very early onset of the Xeomin, and we see it only after 2 to 3 days. Usually, we are making the patient. Yeah, it's the most fastest. I must agree with that.
So that's a big difference. That's a major difference.
Let me tell you something about antibodies.
Meir, can you hear me?
Yeah. Let me ask my colleague, Dr. Friedman, he wants to comment a few words. תגיד לה משהו יפה גם.
Thank you very much for this lecture. And I want to tell you that in my opinion, the antibodies are really important. We are not talking about antibodies that will cause allergy, but more we are talking about antibodies that will make this botulinum toxin non-reactive. And since I'm injecting patients for about 20 years, I do see patients that I need to increase the dosage, and I need to, and the time between the treatment becoming shorter and shorter. So for me, if I can avoid this, it will be great, and it's even more, it's more economical, because usually many of us are charging by the area and not by the units. So if you're keeping the amount of units that you're using to the lowest that you can, it will be more economical for you. So for me, this is a big advantage.
So you see less resistance to the neurotoxin? And you think that has to do?
No, I cannot judge it because I'm using it only for the last 2 to 3 months. That's about it. So I cannot judge it. I'm just talking about what is different in this preparation of botulinum toxin compared to the other. So for me, the biggest advantage is the matter of the antibodies. Because, you know, regarding...
And you refer that you have less patients that are not reacting to the neurotoxin.
I don't have any patients which are non-reactive completely.
Yeah.
But I do have patients that I had to increase the dosage.
Okay.
And the time between treatment was shorter. I cannot comment on the Xeomin because I'm using it only for a few months, so we cannot comment on that.
And you think that this kind of resistance is associated with immunogenicity?
It's a possibility, you know.
It's a possibility. Okay.
In the past, I was in contact with the company trying to get the assay for my patient, for those who are need to increase the dosage, and of course they didn't cooperate with that. So I cannot know for sure. I don't have any scientific data on that for my clinic.
Okay,
but
Maria, thank you, Nimrod. Could you please continue with the presentation? We have a few moments before we get to the cases.
Okay, I just, if you allow me to some comments about the patient with secondary non-response. First of all, I have the best patient with such clinical situations. She's my mom.
Okay.
So from the treatment to treatment, I increased the dosage of the dye spores, and one time she couldn't see any positive effect.
Okay.
So I think that it's very important, not about, so we are clinical doctors and we are scientists, and of course the clinical results depends upon many factors. For example, medical analysis, the technique reasons, okay, because sometimes you can provide very good injection, sometimes you cannot in the muscle, you something here or here, so it depends about many things. But in Russia, the official statistics show us that more than 17% of the patients have secondary non-response and antibodies. And maybe why? Because we start very early. So my patient started the botulinum toxin since 25 years old. Sometimes we're discussing about teenager to prevent some depression, and now we made the clinical trials to use the Xeomin for the teenagers, so 14, 16 years old. We have a long consultation, and after that we made a procedure, and the patient comes again, come back again, and sometimes we will see the secondary non-response. How it is. So yeah.
Let's move to the clinical implications. How many units? Where do you inject it?
Yeah. So I need to change my presentation. 1 second, please.
Yeah, sure.
1 second, please. Just ask my.
You stop the sharing?
Yeah. Everything is fine. Just 1 second, please. It's okay.
By the way, we have 90 participants at this moment, which is nice.
Good. So, is it okay?
Yeah, sure. Yeah, we see that.
Taking dosage, right?
Yeah.
So, This is a protocol of Russian experts. So this is the recommendation of the Russian school and Russian expert, and it corresponded with the international school. But for me, so it's, okay, we keep it in our mind, but it's not very easy, because if you compare, for example, the glabella crowfish, it depends about the gender, about the individual anatomy, about the concentration of the motor neuron plates in the different parts, in a different type of muscle activity, different muscle tone, many aspects. But generally, for the glabella, we will recommend 200 units. For the forehead wrinkles, depends on the gender, depends on the anatomical type. We recommend from 10 to 20 units. Crowfish, 15 for each half face, for each size. Rabbit wrinkles, muscus nasalis, around from 2 to 4, and for lower part of the face, some totally around 50 units. And also we will have a great experience about the neck, about the platysma banks, and about the for the Xeomin, we develop specific technique, like a multipunctal technique, for improve the angle between the neck and the mandibular, and for the forehead as well, we name it Grid 21. So it's very unique, precise, and individual approach, like a piano player. So this is a dosage. And also, it's very important to know that we use a different concentration for different zones to prevent any side effect, and to provide very precise, very natural, this is the most important, natural effect. So for the glabella, we use a standard concentration. For the forehead, for example, sometimes we use a high concentration for the glabella, but here we can use a intramuscular. And for the forehead, in 90%, we use a multifunction technique. If you want, I will show you. I have some clinical pictures, some slides about this with mapping of the face. And I have a lecture whole day only about the forehead and glabella reason, different patterns, how to prevent any side effect. And for example, for the lower part, for the platysma, we dilute it and use the over dilution Xeomin for improve the horizontal necklines and improve the contour of the face. So most of the time we combine different concentration of activin neuroproteins in our for different zone for our patient in the same procedure.
Maria, so let me ask you, please. So you are saying that you actually need to dilute the Xeomin. You have to have two bottles, one with a higher concentration and one with a lower concentration.
No. Let me explain you something how it works.
Okay.
For first of all, we reconstitute the. So let me show you this in new one. We reconstitute the Xeomin 100, for example.
Okay.
Here, while standard dilution is 2 milliliter of physiological solution.
Okay.
And we put physiological solution inside. So it's a normal standard concentration, 100 units with 2 cc of physiological solution.
Okay.
If I need high concentration, for example, for glabella, for which reason? For prevent, because it have a lot of muscle here. So this is a frontalis, this is orbicularis oculi muscle, and this is a couple of eyebrows. This is a corrugator supercilium muscle, right? So we need to be very precise, like a sniper, like a hunter. So I don't want to see any side effect depending on diffusion my product. So the radius must be very short. That's why I use a high concentration. It means that for 100 units, I use 1 cc of physiological solution.
Okay.
In daily practice, most of the time, I use a high concentration firstly, inject a glabella to prevent any side effects, and after that, I redilute it into my syringes, and I provide different concentration for different zones for different reasons.
Okay, that's good. That's a great tip to use, I think. Does it decrease the rate of complications that you have, like ptosis?
100%. It's a very good clinical advice. All of the time, if you want to prevent side effects like droop down of the couple of eyebrows, eye ptosis, true ptosis, eyelid ptosis, I recommend you to use a high concentration because the radius of diffusion is too small.
Could you show us the map of injection points that you mentioned? Is it in this? Okay.
Of course. This is a for glabella, for example. This is a mapping. And this is a dosage. Sometimes we use a 1 point, sometimes we use a 3, 5, 7. It depends about the clinical variety of the glabella, different pattern, for example. And most of the time, this is a very nice publication by my colleagues, Gabriela Casabona. So it depends about vector of construction of the glabella and how it association with the frontalis movement, for example. Different patterns of glabella, different mapping again. So it's not about the Xeomin, it's about the individual anatomy. Because it's a uniform U pattern, medial pattern. It's a very common for Europe, for example, and for Israel, I think the same. And this is the interesting clinical situation, the vector pattern. So it's very typically for men, for example. And this is a mega pattern. So sometimes we use a different depths of injection, not only intramuscular, but in subdermis plane sometimes. And this is inversion of omega. So it's a synergy potential with a corrugator supercilii, depressor supercilii, and musculus nasalis. So if we want to remove the wrinkles here, sometimes we need to inject in the same session to the nasalis here because it's the same movement. So this is a marking. One more. And of course, intraglabal distance, the dosage, depends about the distance between the couple of eyebrow. If you have a large, so I recommend you to use 2.5 units of the Xeomin, but if this is a normal one, so sometimes the dosage will be 5 or 10 units. So I don't have any standard recommendation. It depends about, clinical situation. One more thing.
Maria, could you comment about migration or diffusion of the, because, when they introduced, Botox was the first one to be introduced. And when they introduced Dysport, then the gentleman from Botox said, well, be careful with Dysport because it migrates. And you may have more ptosis with Dysport. Do you agree with that?
No, absolutely not, because it was a clinical trial by Dr. Fink in 2012, and it absolutely clear show us that when we reconstitute the botulinum toxin protein, it doesn't matter, mono botulinum toxin, alpha botulinum toxin, inca botulinum toxin, immediately the complex is dissociated with chemagglutinin proteins and pure toxin. So the active ingredients is totally the same, but unique activity and the diffusion depends, it's not about the molecular weight because it's the same 150 kilodaltons, but it depends about your speed of your injection, the angle of your injection, the individual anatomy and muscle of your patient, because sometimes we have fibrotic tissue, we have a perimysium and myocytes, we have fat here sometimes. So we think that it's a muscle, but if we made a cadaver dissection, it's not. It's absolutely not. It's a fat. So I think it's a huge speculation about the diffusion. All of the products totally the same. It depends about mechanical and technical of the doctors most of the time, and anatomical reason of the patient.
Another thing that I've realized, and maybe it's a subjective concept, I've realized that when I use Dysport, the result tends to be longer.
It depends about...
That's my impression, but maybe I'm wrong. I'm not sure about that.
It depends about the dosage. Sometimes, yeah. How if we compare the good coffee and it's also, it depends how the concentration of the coffee in your cup.
Okay. Could you comment, Maria, about hyperhydration, axillary hyperhydration?
It's we don't have any experience because it's forbidden for us, so we just use it. It's not legally so. But interesting clinical case for man who suffering from hyperhydration of the scalp and seborrhea. We use like a Luciferase syndrome or some syndromes, sympathetic syndromes. We use the over-diluted of Xeomin, 25 units over dilution 3 times with a physiological solution, and it prevents sweating, and it prevents seborrhea for 3 months, and sometimes longer. It keeps longer. So it's a very, very good clinical education, especially for men.
Okay.
And for people suffering from seborrhea as well.
You mentioned the neck. You said hyperdilution in the neck. How many cc's do you add to the neck?
Let me show you something. Okay, it's a foreheads. For the neck, we combine 2 different techniques. For the platysma banks and for Nefertiti lift, we use it. Look at this slide. For the platysma, the medial platysma banks and lateral one, we use the intramuscular injection technique, 2 centimeters between the injection points. Intramuscular, we fixated the platysma banks and inject intramuscular. The dosage amount around 50 units. And in the same procedure, the dosage for one sport, 5 units, around 5 units of the Xeomin. All of the time for Nefertiti lift, we combine it with the 2 major points here. This is the platysma intersection here, and the connection with the mandibular line for lift up effect, because it constricts the grammaticus major and minor, and allows us to achieve the lifting effect. And in the same, this is before and after 2 months, before and after 3 months. And one more thing, in the same session after the platysma banks and Nefertiti lift, we use our over dilution Xeomin. It was published from our colleagues from South Korea in 2015. And we use this technique for improve the skin quality and skin structure. And sometimes we use a lateral part, pretracheal part here for provide them to reduce edema after the botulinum toxin and after filler effect. It really works. And let me show you the clinical pictures before and after. Again, before and after. So it's improved the clarity of the angle here, skin structure, and reduce the edema. So it's great for me.
Okay. Maria, in my practice and many of my colleagues invite the patients for a follow-up visit after 2 weeks, approximately 2 to sometimes 3 weeks. Do you need to do that with the Xeomin?
After 5 days.
After
doctor.
5 days. So you call it.
We're ready to follow up after 5 days.
Okay. And that's it. You don't see them more than that. No.
For the forehead, it's not about some potential of the product. No, sometimes it's about edema, post-traumatic edema. Sometimes we need time to reduce the post-traumatic edema or hematomas. Times to time it's happened with us, but if we are speaking truly about the effect of the Xeomin, it's enough. 5 days, it's more than enough, and we can.
Okay, beautiful. Can we move now to the
follow-up?
Can we move to the cases? Do you have anything that you want to show, or can we move now?
Ask me, maybe some doctors still interesting about some technique, mental, ginger smile, lips. So we made a very nice procedure. We inject the lips contour, the push up, for example, like a jolly lips with the Xeomin, sometimes with a hyperkinetic form, with a ginger smile.
I have cases for you that you can. So I'll move to the cases. And we can discuss your technique. You can comment. Okay, so let's move forward.
I'm feeling like a princess, you know. A lot of fantastic men surround me, so I'm a queen.
Well, there are women in the crowd as well. We have 15 ladies, plastic surgeons in our society.
Hi, ladies.
But they tend to be very quiet. Okay, so great. This is our talk from yesterday. And do you see that? You don't? Okay.
No.
1 second. 1 second.
Can I remark something?
Yes, please.
Guy Nachmani. I have experience with Xeomin from when it was informally launched in Israel. I'm very happy with the Xeomin. One thing that I was told by the Merz guys before I tried it, and I have the impression that is true, a less frozen face is achieved by same injection with Xeomin if you compare it to, for example, Dysport, which was my favorite before. So did you see it at your clinic, Dr. Shirshakova?
Yes, you're absolutely right, but it depends about the dosage, right? So, but commonly, yes, more frozen effect and patient looks more natural. And it's very important, for example, for Russians, because most of us suffering from edema after post-treatment procedure. We use a lot of hyaluronic acid in our parts. So we have some problem with our lymphoinsufficiency and our drainage system. And that's why the Xeomin is still quite more popular first. And the second is really fashion proteins for the young generation of the patient, because they want to look very, very natural. Exactly. And it's more easy to provide the natural effect if you use Xeomin. It's just technical, more easy.
Okay. It's Dr. Friedman. Can you explain to me the logic behind it? Why should one botulinum toxin react differently from the other? Why should we have a less frozen face?
Maria, did you hear the question?
Sorry, the problem. I don't hear you. Can you repeat it? Pardon me.
Yes, sorry. I want to, yes, please let me understand. Why do you think there will be a difference in what you're saying about the frozen face between Xeomin and other products? Because you know, I was at the factory. I spoke with the developer, and for him, botulinum toxin is botulinum toxin. The huge advantages is the way that you need to preserve it, and also the the antibodies. So why should we have any difference in the way that it reacts?
Yeah, the clinically, right? Your
Yes.
question about the clinical reason why we need to recommend the patient.
No, what I'm asking, why do you think that with the Xeomin, you won't have any frozen face?
Yeah, I understand it. So first of all of the neurotoxin has unique specific activities. Nobody knows, but how many motor neuron plates you have or I have, so it's very individual. But generally, we must know that the radius of spreading of the neurotoxin for the Xeomin, it's more precise than for the diasport, for example. This is the first. A second, for the patient, especially for the treatment for the forehead lines, we don't like to visualize the frozen effect because it's for the frontalis muscle is only one big lifting muscle which provides the lifting effect of eyebrows. And we have 3 different types of our patient. For example, first, you know the classification of Mauricio de Mayo as well. Kinetic, overkinetic, and overtonic. So, all the time, I examine my patient about kinetic potential here and the tonus of the muscle. So for me, it's not a correct say that the diasport is frozen effect, Xeomin is not frozen. It depends about the patient. But we need to remove the tonus sometimes, but we need to keep the kinetic potential, the lifting potential of the eyebrow. Very interesting fact, if you want to remove relax for example, this muscle, you need only one, this is a big muscle with a big mass, right? You need inject only one point here. And immediately after, I don't know, 5 days, 2 weeks, it's relaxing, provide the relaxation effect. For the forehead, if you inject high dosage here, for example, diasport or Xeomin, it's not provide the relaxation effect here. It's provide effect like this. Because the mimic muscle, it doesn't have 2 fixated point on a bone, only one. So it's about frozen, no frozen. My answer is it's not, it's more commercial for me. Most of the time thinking about motor neuron plates, how it's concentrated, about 2 things, about the kinetic potential, about strengthening of the muscle. That's why, for example, we measure the eyebrow potential, we draw 2 lines and the measure, because, for example, in my case, it could provide a frozen effect. In your case, no. And the tonus of mimic muscle, because sometimes we need just reduce the tonus. And
so it's a matter of location and dosage, not a matter of the product. Okay, I agree with you.
Yeah,
I think that many patients
about the pharmaceutical companies.
Yeah, I think that I agree with you, Maria. I think that many patients ask now for a non-frozen face. They're looking for faces, especially men. Then they don't want the frozen face. They want a more natural, a little bit moving, a little bit reacting. So we'll proceed now with the clinical cases. And the first one, Maria, is a 56-year-old lady. She comes to you and she tells you, and now I'm asking you as a dermatologist, I want to understand the way that a dermatologist in Moscow thinks. So she comes to you and she says to you, doctor, I want to look better, to look more fresh. What would you offer her? Very quickly, tell me, what would you do?
Okay, she's very nice looking woman, but for me, now is more clearly for me. Okay, I think your problem is a lower part of the face more than the upper one. So the treatment protocol for me will be Altera first, Altera plus radius diluted for skin improvement and improvement the quality of your ligaments in the lower part of the face to provide the lifting effect, and combine it with the botulinum toxin as I showed you before, a Xeomin intramuscular injection for Nefertiti lift. And I would like to inject to deep plane apertura piriformis to lift up the middle cheek and support the ligaments here. And for upper face, a little bit glabella, and also she has an asymmetry, as I can see.
Yeah.
Right eyebrow and the left one. So 20 units because the distance little bit higher for me. And I don't like that she looks like an avatar effect. I don't like it. And she has also lateral parting because the big aponeurosis here. So 4 points, totally 10 or 12 units, but I need to palpate her muscles. I need to palpate it because the line of the muscles, I never measure 2.5 centimeters above the eyebrow. It's a very stupid thing for me. I palpate it, the muscle where is intersection with the aponeurosis. Sometimes it's here, sometimes it's here. And after the palpation and movement assessment, I inject the forehead. And it depends about the form of the eyebrow. So Altera plus radius diluted, hyaluronic acid deep to the piriformis plane, 25 units of Bokuter of the Xeomin in the glabella, 12 units for forehead, and little bit for crow feet for lift up the lateral part of the auricularis oculi muscle. And for here, I also inject a small amount to palpebral part to provide an open eye effect.
Okay.
I think it will be this.
Okay. Would you refer her to a plastic surgeon, by the way?
Yeah.
For a face.
Always the unit plastic surgeon. No,
do you think she's a candidate for surgery?
For the surgery, if she are ready for the surgery, why not? I think we are the best team if we provide the different combinations. So yes, why not? Yeah,
she's a borderline case, I would say. She's not a great candidate for surgery, but she's a possible candidate. Okay, this lady comes to you and she tells you, I don't like my lower eyelids. Eyelids. What would you do?
I ask her, do you know the good plastic surgeon?
Okay.
And I send her your phone number.
What is your opinion about fillers?
No, it's to be serious, excessive skin in the projection of the supraorbital ring, especially for her right side, right? So she has a depression of her temple. So maybe I try to little bit lift up her eyebrow, not for injection of HA here in below the eyebrow, but the little bit lateral compartment of the forehead, temporalis region, and last year for such kind of patient, in some cases it works. I provide, we call it lateral lifting procedure. So it was published by Sebastian Catafana. We inject hyaluronic acid suprasmas plane here in this projection, and it supports the ligament and provide a little bit lift eyebrow effect. But she is a good candidate from eye blepharoplasty.
Maria, would you consider injecting a filler to the lower eyelid?
No.
Why not?
It's
Why
very bad. No, it's a very bad idea. Tell you true, if we analyze my clinical practice, maybe I use 20-25% in 20-25% of the cases hyaluronic acid here. Most of the time, I recommend plastic surgeon operation, or I use energy-based devices like RF or CO2 laser or Alter as well, and only few amount of the patient must be treated with HA gel to prevent any complication.
I agree with you. It's
she's a
procedure.
horrible candidate.
Maria, don't you think that she has some hypertrophy of the lower eyelid muscle?
Of the lower eyelid muscle, excessive skin.
No, it's not excessive skin. It's more like hypertrophy of the muscle.
Of the muscle, yeah, maybe both, and maybe it's atrophy of the bone of the orbital, supraorbital, infraorbital ring. Sometimes it's a malar hypoplasia here because we will see the bone atrophy and we don't have any support of orbicular returning ligaments here and it's dropping down. Or maybe she has some I don't know, neurological problem, because you will see difference between very huge asymmetry between the left and right sides. Maybe it's about muscle activity, maybe it's about the bone support.
Okay, so the day after, her sister shows up in your clinic. Tell us exactly what...
Let's go.
Okay. She's very unhappy. And she tells you, how can you help me to make me more happy?
She is looking like she's suffering from some diseases. So I recommend her to visit her general practitioner doctor. I'm not a good candidate for her.
But she tells you, doctor, you helped my sister with the Botox so nice.
So we know that our face consists from the 5 layers, you know, so there's a bone resorption, there's a muscle atrophy, there's a fat atrophy in her temple zone, it's overstretching the ligaments and drop down the fat here. And so this is a very good example about tonus of the muscle and strength of the muscle. So she has an over tonus of her glabellar region. So, and if in this case we try to inject the botulinum toxin here, it provides a horrible effect and drop down the couple of eyebrows.
This is a patient
maybe this is a good candidate for fillers. For the lateral part of the forehead and the temple zone.
Okay, you don't seem to be very excited about this patient.
Okay. She's very nice girl.
Okay.
And sometimes, may I make some short remarks? Can you show me once more time? Yeah. For the old ladies, sometimes we use a halotox procedure. What it is, we mix Xeomin with hyaluronic fillers. For example, for this lady, I'm thinking about this. For example, for the glabella, 15-20 units we mixed with 1 cc of hyaluronic acid, for example, Bellator Balance for her. And we inject very, very superficially, like a blanching technique. It was published by Dr. Patrick Michaels many years ago. And it provides 2 kinds of effect, little bit my relaxation effect and improves the skin quality. And it's sometimes it's a very good, very good clinical recommendation for such kind of patient. Because
that's interesting.
Hyperkinetic type and hypertonus.
Okay, this young man comes to you and he's complaining about the scar that he has between his eyebrows. What would you do?
CO2 laser, but we need to prepare it with the Xeomin 5 units over diluted superficial injection around the scars and in the projection of the scars, very superficial technique once, and after 1 month, 3 weeks, we follow up with the CO2 laser, for example, with the DECA or AcuPulse, doesn't matter.
Okay. Would you consider a filler?
So it's not necessary right now for the scars, for example. The first step, it will be Xeomin, and after that we use a separate technique with a pure needle. And after separation, sometimes we inject a little bit of, for this young guy, I will recommend you bilateral intense, because the rheological properties of this filler is very good elasticity and viscosity, and it's providing very good clinical effect for the scar.
Wouldn't it be simpler just to do a small excision over there?
Yeah, sometimes we use a separation excision, and after that we inject a filler.
No, just direct excision with a knife.
Ah, with a knife?
Yes, just remove the scar and that's all.
Ah, okay.
That's an option. Okay, this gentleman comes to you. Well, we have 2 questions for you. What is the diagnosis and how would you treat it?
Looks like a herpes, infection, but I'm not sure.
He has that since he was 5. He is 17. He has that since he was 5 years old.
It's like a over vessel production, or because the picture is not very good quality.
The picture is not so good. The picture is not so good.
Yeah, but I don't know. It looks so. It's if it's some over vessels production located in a superficial dermal plate, like a rosacea, for example. Sometimes we can use the over diluted Xeomin, for example, with a combination with IPL treatment, like a M22, you know it. So we're preparing our patient with Xeomin over diluted 25 units, superficial technique, like from acne scars treatment, like for crazy skin treatment. And after 1 month, we follow up with the second step with the IPL treatment for treatment such kind of disorders.
Okay, so you decide, you're not sure what it is, you send a biopsy.
Sure. I need to examine the patient. I need to ask a medical analysis.
Sure.
I need more clear picture.
Is generally healthy. You send a biopsy, a punch biopsy, and the result is epidermal nevus. What would you do then?
Nevus. This is epidermal nevus.
Okay. What would you do for this patient?
So if it just says epidermal nevus, sometimes we recommend the consultation of the surgery of the plastic surgeon if patient want to remove it. Sometimes we provide the laser treatment. Sometimes we still stay living with the nevus because it's not malignizate. So it depends about the biopsy. And it depends about what patient needs.
Okay. Any of the dermatologists in the audience? I saw Dr. Werner, Ines Werner. Are you still there?
Hey, if it's a dermal or epidermal nevus, I think the first thing is to do is CO2 laser, fractional CO2 lasers, and afterwards, if it's still there is a lot of vascularity, I will use OPDL as Dr. Maria said, to use IPL. But for IPL, I'm not sure it will work on such hyperrosacea. It works in very simple rosacea, but in such cases, usually PDL is better.
Okay, next patient comes to your clinic. It's a very busy day, and this patient enters after the other guy. What would you do for this patient?
Nevosota, right? It's a nervous.
Yeah.
One more nevosota, so she needs a dermatological consultation. And yeah, it's a very difficult clinical situation for us. She needs to be treated by in dermatologist department. So it's not a cosmetic. For me, first time it's not a cosmetic patient. So she needs to be examined, and after that we decide what to do. But I would like to know your opinion, because it's very interesting for me. How do you use the Nevosota in your country?
Meir, Nevosota is very popular. We see it a lot of in Asia, and as you know, I'm living part of my time in Asia. What we are doing there, we are using a Q switch and the YAG laser. Usually we are using long pulse, and there is some nice results also with the pico lasers, but don't make them too strong, because if you're making the high fluence, you can create hypopigmentation. So what we usually do is to do Q switch lasers, and usually it works after 2 to 3 treatments. You have an improvement of 70 to 80%.
How many sessions do you recommend for patients who are suffering from
It's very nice to know that Nevosota is working very good to Q switch lasers, and usually you don't need more than 2 to 3 treatment to remove 70 to 80% of the pigment. It's we have very good results with Q switch laser.
Very rare in our country, so it's not typically for us. We know about this, but it's not our typical situation.
Because it's mainly in Asia. In Southeast Asia.
Yeah, it's a very common Asian skin condition. So let us talk about this.
Meir, there are very interested cases, but can we go back to the Xeomin?
Yes, we will, but we want to look at other things as well. Okay, this patient had a spider bite. Had a spider bite in her face. She has a scar on her nose and a scar under her left lower eyelid. What would be, the picture is not that great, but you can see that she has 2 scars. One, the nasal scar is pulling on the nostril. Could you, what would you do with such case? What's your approach to scars?
I don't clearly see the picture. Could you tell me, is it hypertrophic scars or how old?
It's atrophic. It's atrophic.
Hypertrophic. And how old of the patient?
She is 5.
She's 5. I don't have any specialization in pediatrics. For the adult, may I answer about the adult, because I don't have any experience with the kids. I have my kids, but they don't have any scars, okay? So for the adults, we use some steroids, like a deep response. We diluted it 1-to-1 with a physiological solution and inject very superficially. Sometimes we combine deep response with a glucocorticosteroid prolonged form with a plasma PRP. And second step is we use a botulinum toxin for reduce the hearts of together with after depression, because it's very dangerous. So we must control the dosage. We must prevent any side effect. And the last step, we use a CO2 laser for remove the scar and combine it with the 2 interesting things. First of all, with the PRP sometimes, but the second one, our scientific from Russia developed the growth factors, insulin growth factor, and etc. And we apply, it's like a serum, and it's and we will see very good results of the faster rehabilitation and the skin quality after this. So my answer is step by step. Sometimes glucocorticosteroids, sometimes not. Xeomin, plasma, and CO2 laser.
Okay. Okay, next one. This lady comes to you, and she steps into your office, and she tells you, "Doctor, I don't want any kind of surgery. I want to have injection." What would you say to her?
So two kind of problems. The first one, her skin. So it's a photo-aging damaging. So she needs to remove the hyperpigmentation, increase the skin tone because it's an irregularity. She needs hydration. So it's a complex of the procedure, like peelings, IPL, lasers, many things. And the second one, to prevent the ptosis. So step by step, upper parts, middle one, and the lower one. So she needs to combination with a filler of hyaluronic acid for the temples, for the forehead, especially for this zone, to restore the frontal nasal angle, mid-face, of course, and the reduced, the excessive skin. So I recommend to her the combination with bilateral volume, for example, with a radius diluted, 1:1 for the face and 1:2 for the submental zone and 1:4 for the neck, and it needs to be repeated step by step.
So she asks you, Maria, what's the percentage of improvement that I can get with the injections? What do you say to her?
Listen, Dr. Cohen, I'm not a god. I cannot treat the aging. I just want to have this lady to look more younger, to look more fresh, to look more natural, to come back to herself. But I'm not a god to promise that after my treatment you will look like Angelina Jolie in her best times. No, absolutely not.
Okay.
So most of the time I discuss that it will be improvement, but no guarantee.
Some improvement. Okay. Okay, this gentleman comes to you. He is 17, and he has those wrinkles in his forehead. And he says to you, "Doctor, I've read that if you do Botox very early, you age slower. The aging process is much slower." What do you say about that?
Absolutely agree. So this is a new paradigm. So now we don't like to treat age, we prevent. So it's a new concept to prevention and to change the muscle patterns. And we have the clinical cases that we had in our past patient. He was 14, so 4 years old, with and his forehead looks more horrible than this young guy, and his parents asked us, so he couldn't socialize in a school. He in a big depression. Please, could you inject him? It was a Botox because we don't have the Xeomin at that time. And now he's growing, and of course, he has now some wrinkles here, but it's much reduced, and he is married, and he has his kids.
Okay, so you would suggest to a guy at
absolutely.
At 16 to
one more thing, I would like to maybe to inject my daughter, because in her 12, she has a lot, you cannot imagine, a lot of wrinkles in her projection of her forehead, and she's suffering of the depression about this, because the people in the school said, "Oh, you look like a old girl, like your grandma," and she depressed. So I think
would you do that at 12?
My older
Maria,
daughter.
would you do it to your daughter at 12 years old?
Mm-hmm.
You would? Wow, that's interesting. That's interesting.
Yeah, And that's really interesting because it was an interesting clinical trial that they provide injection because for patient for neurological education, you know, some blepharospasm, hemiatrophy, many things. Okay, neurological disorders. We inject for the kids since, I don't know, 1 month, 6 months. So sometimes it's a new paradigm. Who knows? So it's very interesting for me, for the teenagers. Mm-hmm.
Okay, I moved to this case. This guy had, you know, about 20 years ago, we had this ingenious filler called bioalchemine.
Mm-hmm.
The legends say that it originates from Russia.
No.
That's what they say. That's
No.
the legends. So, and then it moved to Italy, and then it came to Israel, and we have injected many patients with bioalchemine. So this patient comes to you, and he has this bioalchemine between his eyebrows. And he wants to, and he talks to you about the crease between his eyebrows. What would you do with this patient?
Be careful. I never inject hyaluronic acid in this zone if my patient has an anamnesis, bioalchemine, biopolymers, etc., silicones, because sometimes it could cause inflammatory reaction, granulomas, and etc. But you need to provide a mimic. You need to reduce the overkinetic activity of the muscles to provide the granuloma reaction. So the Xeomin, it will be great idea to keep his eyebrow safe.
Okay. This gentleman comes to you and he complains about the darkness under his eyes. What do you suggest?
Retinol. So we have a lot. The patient looks like this gentleman. They came from Azerbaijan, Georgia, ethnic pigmentation. So we will have 3 different options. First of all, chemical. I would like to use the arbutin, retinol, some creams, delicate peelings. It marks the peelings around the eye, dark circle removing. One more in our market, we have an injection form. It's a peptides from the South Korea, very good quality, and it's officially registered in Russia. And the last option, lasers, but I prefer to start with the retinol, and after that to continue with injection, and after that we will see.
Would you add a little bit of Xeomin?
Hyperpigmentation.
Would you add a little bit of Xeomin to the lower eyelid?
Maybe for the eyebrow lifting is better.
Oh, okay.
Because he's not have a lot of wrinkles here. Sometimes we need to make a test about the skin quality. So this is my answer. We need to make a test about skin quality. Otherwise, if we relaxated the palpebral part or orbicular part of orbicular ocular muscle, it could cause like this effect. It's not good aesthetic results.
Okay, so this is I brought this example because this patient has this hyperactivity of the lower eyelid. This is when she smiles, and this is when she's natural. And would you consider injecting a neurotoxin here?
Yeah, of course. It is a very good clinical example. Thank you very much that you show us this, because we have a huge amount of patients after the damage of the facial nerve, after virus infection, for example, or trauma or something like this. And this is a very good recommendation. Is the early period after trauma, we inject the Xeomin for the healthy part to improve the another part of the face. So yes, my recommendation provides the injection for the healthy part of the face.
Okay.
Early time after trauma or after damage of the facial nerve.
Okay, I'm just looking at, okay, so that, I think this is our last, oh no, we have more cases. Like this lady comes to you. I brought this patient.
First time in my life. I don't have any experience with that kind of patient, but I try to be
no,
smart girl.
I just wondered if you have any special indication for people with, for patients with dark skin when using the Xeomin?
No, I don't. So no, it's not depend about the ethnic type of or gender or age. Of course, if we become older, sometimes we reduce the dosage. But for the ethnic patient, it doesn't matter. We need to examine the muscle potential, and we need to examine the muscle, the mass of mimic muscle, and develop the individual protocol for the patient, and it doesn't matter which ethnic they are.
Okay. This patient comes to you. You see this hollow on the forehead on the left side?
Yeah.
What would you suggest? Anything to him? Would you?
Very simple, very easy technique. 2 points, cannula 22, bilateral intense, submuscle plane, vector fanning technique, and provide a little massage. And this is my regular practice, and it works fantastic.
Okay. Okay. I promised you that we'll have some acne cases. So what would you do with these atrophic scars, like ice pick scars?
Ice pick, yeah. So it's not a very good candidate for the Xeomin, tell you true, because it's really ice pick scars. So it's very difficult clinical case for us. So maybe it must to be prepared with.
How is this guy?
It's better.
Okay.
Greasy skin, enlarged pores, non-inflammational, acne scars. So 30-35 units of Xeomin, over dilution, intradermis injection technique, whole cheek, nose. Very interesting data that after Xeomin injection for the projection of the nose tip, it looks more thinner. And I found the findings about the lipid-dissolving effect of the botulinum toxin that now I'm preparing. Sorry that I'm speaking about the nose, but it's interesting for you because some of my colleagues, plastic surgeon, asked me, Dr. Maria, could you preparing my patient before the plastic surgery operation? And all of them said me that it was very easy to make the plastic surgery operation after. The movement of the nose of the tip is better, the skin is better, so maybe it's a good suggestion. Come back to the scars. So 25-30 units, over dilution, the distance between injection point 1 centimeter, 1 centimeter between the line, whole cheek, right cheek, left one, nose, T-zone, and the mental one. And sometimes we need to repeat it after 1 month, sometimes we need to repeat it after 3 months, and after that we need to combine it with a PRP or CO2 laser, or sometimes people extremely satisfied. Who knows? It depends about the quality of the scars and the deepness and many things.
Maria, how does the Xeomin work?
It's cheaper and it works because you don't need a lot of amount.
2 questions. How does Xeomin work on acne scars? And
it's a long it's a long lecture about a long topic. To conclude, 3 different things. First, a fibroblast. Second, substance P. And the third one, the muscle, the pupil muscle. So it's clinically, we will see the improvement of skin surface. Improvement of skin surface.
Maybe you refer to erectile pili muscle. It's the small muscle that that is attached to the hair bulb. Okay, that's interesting. I've never heard that. That's quite new for me.
And myofibroblast as well, because if you made a biopsy from the scars, you can find the specific cells. We call it myofibroblast. So it constricts the tissue. So it provides a relaxation effect, and it was published 2 or 3 years ago.
Great. So now this is our last case. And I would could you just in detail explain to us, how would you treat, this is a classic patient for Botox. How many units would you put in each area? How would you dilute the Xeomin? And how would you follow up on this patient, and so on? Just to conclude your lecture.
Okay, for example, for the man, it doesn't matter how they look. They want to look very masculine, so it's not necessary to dissolve all of the wrinkles. Sometimes it looks very strange without any wrinkles, right? Yes. So for the man, sometimes we use. Typically, all of the speakers said we need to increase the dosage. For me, it's not, because we need to discuss with the patient what kind of effect do you want to see. Sometimes it looks like a frozen, no movement. It's not good. It's a patient does not satisfy. So for this man, okay, for the glabella, I don't hear. So I need a movement of the muscle, okay? Because in the static, it's sometimes it's difficult, but in my imagination, one point to the glabella close to the fixation on the bone here, because he has a drooping of the eyebrows, and this is higher. This sometimes is some fibers of the frontalis muscle. So if you inject here to the higher, the classical one, if you connect, for example, couple of eyebrow and medial contours like this, and the classical education in inject here, sometimes it provides the ptosis effect. So the first one, high concentration of the Xeomin, 1 cc of physiological solution for 200 units. This is the point of injection. 8 units of the Xeomin, for example, for the procerus muscle, because we know.
So you will take a 50 unit ampule. You will add 1 cc of physiological.
0.5 for concentration product, high concentration product, 0.5 for
100 for 50
for
or
100 1 cc.
1 cc. Okay. And you will take, so if you are using an insulin syringe, a 1 cc insulin.
It means I prepare it.
Yeah, this one.
Prepared.
So
each marks 2 units.
Okay.
Here, it marks 2 units because it's 1 cc. 0.5 cc, it means 1 marks 1 unit.
Okay.
Here, the same, 1 marks 1 unit.
Okay. So you would put the high concentration here, and then when you move into this area.
Corrugator superciliary muscle, deep injection in the projection of the eyebrow, perpendicularly injection in the concentration of motor neuron plates, 8 units. Here, the depressor superciliary muscle, 1 unit, high concentrated solution, right? So this is glabella. Maybe, I don't know, I need movement. Maybe lateral part of the corrugator, superficial one, like a papal technique, here, but I don't know. Sometimes we have an intersection between the fibers of the corrugator, for example, omega or inverse omega. Here, sometimes we provide a little bit up here, deep injection, because it's the intersection between the frontalis and corrugator fibers, here and here. So this is a glabella. Totally 25 units.
In this area?
This here area, big question, because I need a movement.
Okay.
Yeah. So so the wrinkle for me is nothing. I'm always thinking about the muscle fibers. Wrinkles is nothing, but let me show you something. I make a marking. So I draw the middle face line. I draw the middle canthus lifting axis line. I draw the vertical intrapupillary lifting lines, and I draw the lateral canthus line. And I divide the forehead in two different functional parts, okay? Lower one and an upper one, because sometimes we have two different functional parts of the frontalis muscle. And it depends what do you need. For example, if you need to lift up the lateral eyebrows lateral lift up like a Mephisto effect, you need to, and it depends about aponeurosis, long or short, wide or narrow, I don't know. But you palpate it with your fingers here and assessment the movement and bespoke the points, and after that you inject from 1 to 3 units standard dilution, or maybe multi-puncture injection like a wave. Intradermis, the same amount, around 10, 12, 20, because nobody knows before examination. So the forehead is the most difficult part for me for the aesthetic treatment, because some of us thinking that if we inject here, we provide lift up eyebrow effect. It's not true. True lifting effect we can achieve only if we find the balance between the medial part of the eyebrow and the lateral one first, and between two different functional parts of the forehead, and the third one between the ventral of frontalis and ventral of occipitalis, because the patient with movement aponeurosis tissue, you can use only highest injection here, and it constrict occipitalis, and your eyebrows lit up, goes up, and it looks like after plastic surgeon operation. But sometimes it doesn't work. It doesn't work. For bicularis oculi muscle, we use a different technique.
This area here, would you use that high concentration or low concentration?
For this man, I will recommend you, because he has a skin atrophy and very thin muscle and no fat. The fat goes down, goes out. So for this clinical case, I recommend standard or high concentration of the Xeomin, and this lateral part of the eyebrows drop down, and the eyelid it goes down too. So sometimes we use a neurological technique how to lift the palpebral part of the orbit. So we inject not only the lateral part, but the small amount here in the palpebral part, in the palpebral part, and in the border between the palpebra and orbital part, and
here.
It helps me.
Would you do it here? Wow.
Very superficial, small amount, and it helps me to lift strict musculus levator palpebral superioris, and the palpebra lifts up 1 millimeter, 2 millimeters, but sometimes it's enough.
That's a great trick. I never tried that. Thank you. That's a great trick that I've never tried.
Thank you.
And Yeah, it's almost 2 hours. It passed so quickly.
Like 1 minute.
Like 1
made
minute.
me so happy, Giola.
I want to thank you, Dr. Shirshakova, so much for your time and for the great tips that you gave us. Very interesting. I've learned a lot. I think it's obvious that you have great experience with the Xeomin, and I'm so happy that we had the opportunity to learn from you. And I hope that we meet again very soon in better times. And happy Easter, I think. Easter is...
Oh, thank you very much. Yeah, Easter is coming.
Easter is coming. So
yeah.
enjoy the holiday. You are in holiday anyway, so enjoy the rest of the holiday and have a great weekend. And thank you, everybody. We meet again on Sunday at 8 p.m. for another meeting with Dr. Udi Maor. So, Dr. Shirshakova, thank you so much and good evening to you all.
Thank you very much.
Thank you, до свидания.
Thank
All
you.
the best. до свидания.
תודה רבה.
תודה רבה.
Thank you. Bye bye.
Bye-bye.
Bye bye.